Your doctor is not trying to hurt you, but there's a very good chance that the test they're about to order will set off a chain of events that leaves you worse off than before you walked in. And nobody warned you. I'm going to. Stay with me for the next few minutes because what I'm about to share could be one of the most important things you hear this year, especially if you're 60, 65, 70, or beyond. I've spent years working at the intersection of medicine, patient advocacy, and what I call the moment nobody tells you about. The moment after the test comes back and the medical system takes over. I'm not here to scare you. I'm here to sit with you, the way a trusted friend with medical knowledge would, and say, ask the right questions before you say yes to anything. I want to tell you about a woman I'll call Paris, 72 years old, retired school teacher, sharp, active, walking her neighborhood every morning. She went in for a routine checkup, felt perfectly fine, no symptoms. Her doctor ordered a few standard screenings, just to be safe. 3 months later, Dorothy was recovering from a surgical procedure. She had pain she didn't have before. She was afraid in ways she wasn't before. And the cruelest part? The thing they found and treated would likely never have caused her a single problem in her remaining years. Paris's story is not rare. It is happening in doctors' offices right now, maybe yours. The truth about screening after 60. Here's something your doctor may never explain clearly, and it's not their fault. The medical system doesn't reward them for having this conversation. Screening tests were designed for one purpose: find disease early, treat it, extend your life. And at 45 or 50, they work beautifully. But after 60, and especially after 70, something fundamental changes. Our bodies begin carrying what doctors call incidentalomas, findings, shadows, spots, slow-growing things that were always there, that your body was managing quietly, that would never have introduced themselves to you in your lifetime. But once a test finds something, that's it. You can't unfind it. The medical system is built to investigate, to biopsy, to treat, and every single step in that chain carries risk. The question stops being, should we find problems? The question becomes, is finding this problem going to help me or start something I can't stop? Let me walk you through 5 screenings where that answer, for many people over 60, is complicated, and where you deserve the full picture before you agree. The 5 screenings. Number 1, routine colonoscopy after 75. I want to be clear, colonoscopies in your 50s and 60s have genuinely saved lives. That data is real. But most major guidelines, including the American Cancer Society, now say that for people with previous normal screenings and average risk, routine colonoscopy after 75 is no longer automatically recommended. Here's why this matters to you personally. Colorectal cancer is slow. Polyps take years, sometimes a decade, to become dangerous. If you've had clean scopes before, the odds that a new cancer found at 77 will significantly shorten your life are actually quite low. But the risks of the procedure? They go up with age. The bowel prep, the laxatives, the diarrhea, the day of misery can cause dangerous dehydration and dangerous drops in blood pressure in older adults. The sedation carries its own risks, and if a polyp is found and removed, there is a real risk of bleeding or, in rare but documented cases, perforation of the colon. I have spoken to families whose loved ones entered a routine colonoscopy and never quite recovered from the cascade that followed. This doesn't mean you refuse. It means you ask. Ask your doctor, have I had normal scopes before? Given my age and health, what's the realistic benefit here? A good doctor will welcome that question. Number 2, PSA testing and mammograms after 75. This one is deeply personal for many of you, and I want to handle it with care. Cancer screening has saved lives. I believe that. But there is a point, and it's different for every person, where finding a certain cancer causes more suffering than the cancer itself would have. The U.S. Preventive Services Task Force recommends against routine PSA screening in men over 70. Why? Because autopsy studies show that the majority of men over 70 already have prostate cancer cells in their body, cells their immune system is managing, cells that will never cause symptoms. But if a PSA test finds an elevated level, the cascade begins. A biopsy, a diagnosis, a conversation about surgery or radiation, side effects that change quality of life, incontinence, fatigue, loss of intimacy. For a cancer, that was never going to announce itself. For women, mammogram guidelines similarly suggest that after 75, especially with other health conditions, the calculus changes. Early-stage cancers found in women in their 80s are often incredibly slow-growing. The treatment, surgery, radiation, can reduce quality of life more than the cancer would have. I am not saying don't screen. I am saying, at your age, at your health level, what does the full picture look like? Ask. Number 3, routine cardiac stress testing. Here's a scenario I want you to picture. You're 68, no chest pain, no shortness of breath. You feel fine, but your doctor orders a stress test just to check. The stress test shows something, maybe just a small irregularity, an anomaly. So a cardiologist orders a cardiac catheterization, where they thread a tube through your blood vessels to look inside your heart. That procedure has real risks: stroke from dislodged plaque, kidney damage from the contrast dye, bleeding. The catheterization shows some blockages, not complete, not causing you symptoms, but they're there. So now the conversation turns to stents or bypass surgery. Here is what the data shows, and this is from large, rigorous clinical trials: the COURAGE trial, the ISCHEMIA trial. In people without symptoms, stenting or bypassing blockages does not reduce heart attacks or extend life better than medication alone. But finding those blockages started a cascade that ends on an operating table. The American College of Cardiology does not recommend routine stress testing in people without symptoms, and yet it happens constantly. If your doctor wants to order a stress test and you have no symptoms, ask why. Ask what happens next if they find something. That question alone may change the conversation. Number 4, bone density scans and automatic medication. DEXA scans, bone density tests, are recommended, and often they are appropriate. Hip fractures in elderly adults are serious, deadly sometimes. But here's the nuance that doesn't always get communicated. When a DEXA scan shows low bone density, many doctors automatically prescribe bisphosphonate medications, drugs like Fosamax. These medications do modestly reduce fracture risk, but they also carry risks: esophageal irritation, and with long-term use, a paradoxical increased risk of a different kind of femur fracture. There can also be complications with dental procedures. More importantly, for people over 80 who are frail or have limited mobility, the real fracture risk is falling, not bone density numbers. Falling because of balance issues, muscle weakness, or medications that cause dizziness. Treating a number on a scan while ignoring the actual fall risk is like patching a hole in the roof while ignoring the flood coming through the front door. The conversation should be about strength training, about balance, about reviewing every medication that could make you dizzy. That prevents fractures. Number 5, carotid artery ultrasound screening. This one breaks my heart because it's often sold as a gift, a proactive thing you can do for yourself, sometimes at a health fair, sometimes as part of a vascular screening package. A carotid artery ultrasound looks for blockages in the arteries in your neck that feed your brain. The idea sounds good. Catch a potential stroke before it happens. But here's the evidence. The U.S. Preventive Services Task Force recommends against routine carotid screening in people without symptoms. No history of stroke, no TIA, no warning signs. Why? Because when they find an asymptomatic blockage and operate to fix it through surgery or stenting, the risk of causing a stroke during the procedure is not meaningfully lower than the risk of leaving it alone and managing it with medication. I have heard from patients who walked into a health fair feeling fine. The screening found a blockage. Surgery was recommended, and they came out with a deficit, a weakness, a speech issue that they did not have going in. The procedure meant to prevent the stroke caused one. You were trying to be proactive. The system failed you. Why this keeps happening? I want you to hear this without anger, because the doctors ordering these tests are largely not doing it maliciously. They are doing it because they were trained to find and fix. Because the system incentivizes testing, procedures generate revenue. Because liability pushes them toward doing more, not less. And because we, patients, have been trained for decades to believe that more screening equals better care. It doesn't. Not always. Not after 60. And nobody gets punished for overscreening. Nobody loses their license for ordering one extra test. But you bear the consequences. So what do? Here's exactly how to protect yourself. 1. Ask the cascade question. Before any screening, ask your doctor, if this test finds something, what happens next? What are the risks of those next steps? And given my age and current health, is the benefit likely to outweigh those risks? A good doctor will not be offended. A great doctor will be grateful. 2. Know the guidelines. The U.S. Preventive Services Task Force publishes clear, evidence-based screening recommendations. Most have age cutoffs. You can look these up. Bring them to your appointment. 3. Redefine what health means at this stage. After 60, health isn't about eliminating every possible risk on a scan. It's about feeling good, maintaining independence, staying sharp, staying connected. Procedures and hospitalizations threaten all of that. 4. Find a doctor who practices with nuance. Some doctors are extraordinary at this. They see you as a whole person, not a collection of numbers to optimize. They exist. They're worth seeking. 5. Remember, you can say no. You are not obligated to accept any screening. You can decline, politely and firmly. You are the one who lives with the consequences. You are the one in control. Paris, the retired teacher I mentioned at the beginning, she eventually found a doctor who sat down with her, looked at her full picture and said, "You know what? I don't think we needed to do that." And she told me, "I just wish someone had said that before." You deserve to hear it before. You have lived long enough to know that more is not always better, that sometimes the wisest thing is to pause, to ask, to choose. Your job is not to find every problem in your body. Your job is to live well, for as long and as fully as possible. And sometimes, the most powerful thing you can do for your health is to look at that referral, look at that order for another screening, and ask a simple question. Doctor, do I really need this? If this video made you think, really think, about a test you've been scheduled for, I want to hear from you. Drop a comment below and tell me, which of these 5 screenings surprised you most? Your comment might be the thing that helps someone else reading this make a better decision. And if you have a parent, a sibling, a friend over 60, share this with them. Not to scare them, to give them the words to ask better questions. That's all medicine really is at its best. The right questions, asked at the right time. I'll see you in the next one.